If you've ever woken up with stiff joints, maybe felt that persistent ache in your knees, or, watched someone you care about struggle with simple movements, you've encountered something incredibly common. It often gets dismissed as just getting old, right? But what seems like simple joint pain is actually, well, a really complex group of conditions affecting millions worldwide. So today we're doing a deep dive into arthritis. We're going to go way beyond that common idea of just wear and tear. We want to unpack the intricate mechanisms and the wide-ranging impacts of this pervasive health issue that really touches so many lives.
That's right. And to really get a handle on this common yet, like you said, complex condition, we're going to break it down. We'll explore its many forms, what causes them, how doctors actually figure out which type it is, and the treatments available now. And it's really important to remember, as our sources point out, arthritis isn't just one thing. It's more of a general medical term covering over 100 different disorders affecting joints and the tissues around them.
Yeah, over 100, that's huge. And to navigate this, we've looked at some really comprehensive material. There's a detailed medical overview that sort of sets the stage, and a foundational article, too. We've woven these together to hopefully give you a holistic understanding, whether you're new to this or maybe looking to deepen what you already know. Okay, let's get right to the core of it. The name itself, arthritis, is a good starting point, isn't it? Most of us just think joint pain, but literally it breaks down arthro meaning joint and ainatus meaning inflammation.
Exactly. Joint inflammation, that's the heart of it. And while joint pain and stiffness are, the classic symptoms you'd expect, the picture is often broader. You might also get redness, warmth, swelling, maybe a decreased range of motion in those joints. But what's fascinating is how these common signs can vary so much in combination severity depending on the specific type of arthritis.
Right. It's not one size fits all. And the impact goes beyond the joints, too. Our sources highlight that arthritis is a major reason people can't work, leading to, well, lost productivity and income. It can also really reduce someone's ability to do everyday things, opening a jar, climbing stairs, things we take for granted. And in some types, it's not just the joints. Other organs, like the skin, can get involved too.
That's a crucial point, the systemic nature of some types.
Okay, so we know it's about joint inflammation, broad impacts, but the types, that's where the complexity really kicks in. I guess for most people, the first one that springs to mind is osteoarthritis, OA.
OA is definitely the most common. Yeah, it's often called that wear and tear arthritis. Basically, the cartilage, the cushion on the ends of your bones, it gradually breaks down, maybe from an old injury or just long-term use. Eventually, you can get bone rubbing right on bone, causing that grinding feeling and significant pain. Symptoms usually start small, maybe some discomfort when you move, but over time, they can become constant, even when you're resting.
Ouch. And which joints does it usually hit?
Primarily weight-bearing ones, hips, knees, shoulders are common. But also, you see it a lot in the fingers. It's largely a condition associated with getting older. Age is the strongest predictor, really, because our body's ability to maintain cartilage just naturally declines.
And doctors can actually see this on an x-ray, can't they? What are they looking for?
Yeah, x-rays are key for OA. They look for joint space narrowing that shows the cartilage is breaking down. They also look for bone spurs, chlorosis, which is a hardening of the bone, and sometimes bone cysts, all telltale signs of that wear process.
Okay. Now, rheumatoid arthritis, RA, that's a whole different ballgame, right?
Yeah.
Different mechanism entirely.
Absolutely different. RA is it's an autoimmune disorder. Your own immune system mistakenly attacks the lining of the joint capsule, the synovium. This causes widespread inflammation, swelling. And what's really distinctive about RA is that it's often symmetrical.
Symmetrical.
Meaning it affects the same joints on both sides of the body. So both wrists, or both knees, fingers on both hands, elbows. That pattern is a big clue.
Ah, okay. That makes sense.
And unlike OA, RA can affect other parts of the body, not just joints. Plus, it usually starts earlier in life, often people aged 20 and up. In kids, it can even show up with things like a skin rash, fever, pain, significant disability sometimes.
Wow. And the inflammation process itself in RA, it's quite specific.
It's very complex, yeah. It involves these chemical messengers, pro-inflammatory cytokines, like one called interleukin-17, IL-17, and also cell surface proteins like RANKL. These essentially signal the immune system to attack and break down the joint, leading to bone erosion. Understanding these specific molecules is actually really important because many modern RA treatments target them directly.
That distinction is so important, isn't it? It really shows why getting the right diagnosis matters. The treatments are just so different. Does that mean it's sometimes tricky to tell OA and RA apart initially?
It can be, especially early on. but there are key differences doctors look for.
Like the morning stiffness in RA, I've heard about that lasting more than 30 minutes.
Exactly. That prolonged morning stiffness is a classic RA symptom, and blood tests are vital too. Doctors look for elevated ESR or CRP levels. Those indicate inflammation generally. But more specifically for RA, they test for anti-CCP antibodies and rheumatoid factor, or RF. Finding those really points towards RA. Very different markers than for OA.
Okay. Let's shift gears slightly. Another type people often hear about, sometimes linked to lifestyle, is gout, that old image of someone indulging too much. Is there some truth to that?
There certainly can be, yeah.
Hmm.
Gout is caused by too much uric acid building up in the body. This leads to urate crystals forming and getting deposited in joints. Often in the extremities, the big toe is famous for it, but also knees, fingers. And during a flare-up, the pain can be, well, excruciating. You often see visible swelling, warmth, redness too. And yes, our sources do confirm a strong link to diet, particularly excessive alcohol and foods high in purines, like red meat.
Right, and there's also something called pseudo-gout.
Yeah, briefly, pseudogout is less common. It's caused by different crystals, calcium pyrophosphate crystals. Unfortunately, unlike gout, we don't really have targeted treatments for pseudogout right now.
Okay. And lupus, another autoimmune connection, but it affects the body even more broadly.
Yes, lupus is the significant one. It's an autoimmune collagen vascular disorder. About 90% of people with lupus have musculoskeletal issues. The symptoms can often mimic RA, similar stiffness, pain patterns, especially fingers, wrists, knees.
But it has other signs too.
Definitely.
Yeah.
Things like the characteristic butterfly rash across the face, uh, extreme sensitivity to sunlight, hair loss, kidney problems, even shortness of breath if the lungs get scarred. It's much more systemic.
It sounds incredibly challenging. Okay, just to round things out, maybe quickly touch on a couple of other important types.
Sure. First, there's septic arthritis or infectious arthritis. This is serious. It usually happens when bacteria from an infection somewhere else travel through the bloodstream to a joint. It causes a sudden onset, chills, fever, really intense joint pain. Fast diagnosis and treatment are crucial to prevent permanent joint damage. And interestingly, viruses like SARS-CoV-2, the COVID virus, can trigger something called reactive arthritis, which is a bit different from a direct joint infection.
Okay, septic arthritis needs quick action. What else?
Then there's psoriatic arthritis. This often develops after someone has the skin symptoms of psoriasis, those scaly patches, itchiness. Patients then get continuous joint pain, stiffness, swelling. It can be quite destructive, especially to the small joints in the hands.
And finally.
Finally, there's something called undifferentiated arthritis. That's basically when someone clearly has inflammatory arthritis, but it doesn't neatly fit the criteria for any of the well-known types like RA or psoriatic arthritis. Yeah. It could potentially be an early stage of one of those conditions before it fully declares itself.
Okay, that's a really helpful overview of the sheer variety. So we've covered the what. That leads us naturally to the why. What are the underlying causes and risk factors driving these conditions?
Right. The why. Well, there are several common risk factors. Some we can't change, some we potentially can. In the non-modifiable camp, age is a big one, especially for OA, as we said. It just gets more common as you get older. Sex also plays a role. Inflammatory types like RA and lupus are generally more common in women. And family history, having relatives with arthritis, particularly the inflammatory kinds, definitely increases your own risk.
Okay, those are the ones we're stuck with. What about things people can influence?
On the modifiable side, obesity is major. Extra weight puts more strain on weight-bearing joints, worsening OA, and it's also a risk factor for inflammatory types too. Previous joint injuries are another one. An old knee injury, for example, can significantly increase your risk of developing OA in that knee later on. An injury is also a risk factor for inflammatory types. And lastly, exposure to tobacco smoke. There's a strong link showing it increases susceptibility, especially for developing rheumatoid arthritis.
Smoking, too. Interesting. Okay, understanding all these types and causes, it makes the diagnostic journey seem quite complex. I imagine figuring out which types someone has can be really tricky. Is there something that often surprises people about how doctors diagnose arthritis?
I think what often surprises people is how much weight doctors put on the patient's own story and a really thorough physical exam. That's the crucial starting point. It's not just about running a battery of tests right away.
The conversation is key.
Absolutely. Then based on that, they use supporting tests to confirm or clarify things. Imaging tests are vital. X-rays, as we mentioned, are common for diagnosing and monitoring OA, showing the joint space narrowing, bone spurs. For RA, sometimes more advanced imaging like CT scans, PT scans, bone scans, even DEXA scans might be used.
And then blood tests.
Blood tests, yes. Things like rheumatoid factor, RF, anti-nuclear factor, ANF, specific antibodies, ESR, CRP. These help detect inflammation, particularly for those inflammatory types like RA. Anti-CCP antibodies and RF are especially key indicators for RA. And sometimes joint fluid analysis is needed. They actually draw fluid from the joint.
Wow. What does that tell them?
It can tell them a lot. For example, normal joint fluid has very few white blood cells. It's thick and clear. But fluid from, say, septic arthritis might have tens of thousands of white blood cells, mostly neutrophils. It'll be thin and look cloudy yellow. These details can really help pinpoint the cause.
Incredible. And it's clear those symptom patterns are also vital clues. Like you said, RA pain worse in the morning, stiffness over 30 minutes, while OA might start more with activity.
Exactly. Doctors look very carefully at things like how quickly the symptoms started, the pattern, is it symmetrical or just one side? Is there morning stiffness? And for how long? Also, tenderness, any joint locking, what makes it better or worse, and are there any other symptoms elsewhere in the body? Systemic signs. It's like detective work.
It really sounds like it. So, while there's no known cure for most types of arthritis and rheumatic diseases, it's really important to stress that there are significant management options available today, things that can dramatically improve quality of life. What are the main paths to relief for patients?
Yeah, management is key. And the first path, often the most impactful, is physical therapy and regular exercise. Study after study shows that consistent physical activity significantly improves long-term pain relief, improves function, and can even delay the need for surgery. For knee OA specifically, exercise can actually be more effective than medications, focusing on strength, endurance, flexibility.
More effective than meds. That's powerful.
Oh, yeah.
But medications still play a role, right?
Oh, absolutely. Treatment usually starts with options having the fewest side effects. For osteoarthritis, acetaminophen or paracetamol is often first line. Topical NSAIDs like creams or gels are generally preferred over oral pills because they have a better safety profile. For severe OA flare-ups, intra-articular corticosteroid injections directly into the joint can provide relief.
And for the inflammatory types.
For inflammatory arthritis, like RA or psoriatic arthritis, non-steroidal anti-inflammatory drugs, NSAIDs like ibuprofen, are often a first step for symptom relief.
Mm.
But for rheumatoid arthritis, because it's autoimmune, the treatments go further. They might include corticosteroids, newer monoclonal antibodies, and a class called disease-modifying anti-rheumatic drugs, or DMARDs. These DMARDs, things like conventional synthetic ones, TNF biologics, targeted synthetic ones, aim to actually slow down the disease progression by influencing the immune response, targeting those pathways like IL-17 we talked about earlier.
So, trying to tackle the underlying cause, what about surgery? When does that become an option?
Surgery is usually reserved for severe cases where other treatments haven't provided enough relief and joint damage is significant. Primarily, we're talking about joint replacement surgery, arthroplasty, most common for the shoulder, hip, and knee. These artificial joints can be incredibly successful, lasting maybe 15 to 70 years, sometimes longer. They really allow patients to get back to activities, swimming, tennis, golf. It's life-changing.
That's amazing.
It is. Though interestingly, for knee OA, research has shown that arthroscopic surgery, sort of a clean-out procedure, doesn't actually provide additional benefit compared to just optimizing physical therapy and medical management. So less invasive is often better there.
Good to know. And what about those day-to-day struggles? Turning keys, opening jars, adaptive aids must be crucial.
Oh, absolutely essential for many people. Especially with hand arthritis, those simple tasks become incredibly difficult and painful. Adaptive aids are just assistive devices designed to make those activities easier, special grips, openers, things like that. They make a huge difference in maintaining independence. And while some can be pricey, there's a growing movement using 3D printing to create open-source designs, making them much more affordable and accessible. The vast majority of patients need and use these aids. It highlights how important they are for quality of life.
That's fantastic about the 3D printing. Now, what about alternative medicine? Things like TNNS units or laser therapy? What's the evidence say?
It's a bit of a mixed bag, and more research is needed for many of these. 10NS, transcutaneous electrical nerve stimulation for knee OA pain control. The evidence is still considered insufficient by many guidelines. Needs more study. Low-level laser therapy, there's some tentative evidence suggesting it might help relieve pain and stiffness. And pulsed electromagnetic field therapy, PEMFT. Again, tentative evidence for improving function in OA, but not really for pain relief itself. It's not FDA approved for arthritis in the US, though it is licensed up in Canada for arthritis pain. So yeah, it's really important for people to discuss these options thoroughly with their doctor.
Always best to check with your doctor. Okay, let's zoom out a bit now. Look at arthritis in the wider world, its epidemiology and societal impact. This isn't just an individual health problem, is it?
Far from it. While we often associate it with the elderly, remember kids get arthritis too, it's generally more common in women than men across all age groups, and it truly affects all races, ethnic groups, and cultures worldwide. Just looking at the U.S., data from a few years back showed about 54.4 million adults, that's nearly 23%, had doctor-diagnosed arthritis. And of those, almost half, 23.7 million people had their activities limited because of their arthritis. And with populations aging, these numbers are expected to climb.
Almost 24 million people with activity limitations. It's staggering. And the economic cost.
It's huge. In the U.S. alone, the total cost is estimated near $100 billion annually. But what's really striking is our sources notice that almost half of that cost comes from lost earnings.
Yeah.
People unable to work or having to reduce hours.
Wow, nearly $50 billion just in lost earnings. That really underscores how debilitating it can be.
Absolutely. And we also see strong links with other chronic conditions. Adults with heart disease, diabetes, obesity, they all have a higher prevalence of doctor-diagnosed arthritis. Globally, the numbers are significant too. Around 15% prevalence in Australia, over 20% in the U.S., as we said. And a review looking at Africa found some interesting variations. RE prevalence ranged from maybe 0.1% in some rural areas up to 2.5% in urban settings in South Africa. But osteoarthritis prevalence in South Africans over 65 ranged from about 30% to over 80% in some studies. NEOA was particularly high, around 33% in rural South Africa. It really shows the scale and variation.
Huge impact on lives, on healthcare systems everywhere. Think about how common it is now. It makes you wonder, how long has arthritis actually been around? Let's look back at the history. It's not exactly a modern disease, is it?
Not even close. Evidence of arthritis, likely osteoarthritis, has even been found in dinosaurs.
Seriously, dinosaurs.
Yeah. And for humans, the first known traces go way back, maybe 4,500 BC. It's often called the most common ailment found in prehistoric peoples. We've seen evidence in skeletal remains of Native Americans, in Ötzi the Iceman mummy from around 3000 BC, even Egyptian mummies dating back to roughly 2590 BC. It's been with us for millennia.
That's incredible. Part of the human condition almost.
It seems so. Fast forward quite a bit, and you start to see the foundations of modern understanding being laid. In 1715, William Musgrave published a key work, De Arthritis Symptomatica, one of the first real attempts to medically analyze and categorize different types of arthritis. Then, in the early 1800s, Augustin Jacob Landré Beauvais was the first to really describe the symptoms of rheumatoid arthritis as something distinct. Even though he initially linked it closely with gout, he recognized it was different.
And then a huge leap forward in treatment came much later.
A massive leap. In the 1960s, Sir John Charnley performed the first modern successful total hip replacement, specifically to treat arthritis, in England. That really revolutionized the treatment of severe joint degeneration and offered hope and mobility back to countless people. A true game changer in orthopedics.
What a journey. Okay, as we wrap up this deep dive, it's really struck me just how broad this topic of arthritis is. From dinosaurs to modern joint replacements, ancient aches to cutting-edge biologic drugs, it's a clear reminder that while it's a chronic condition affecting millions, effective management is very possible and can truly transform lives, allowing people to maintain a good quality of life.
Absolutely. And knowing there are so many forms and understanding its incredibly long history, it does raise a fascinating question for the future, doesn't it? What surprising ways might our understanding and management of all these diverse joint conditions evolve in the next century? Especially now, with advances like personalized medicine and AI really taking off, how might they change the game?
That is a powerful thought to leave everyone with. We hope this deep dive maybe changes your perspective a little on those everyday aches and pains, or perhaps even inspires you to continue your own exploration into the areas that caught your interest today.